Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. This is the second episode from a two-part interview where I've been speaking with Kristen Winter, Vice President of Human Resources, Workforce Optimization and Leadership at Sunnybrook Health Sciences Centre in Toronto. Hi, Kristen. Welcome back to the HQ.
Thanks for having me.
When you were last with us, Kristen, you shared the impact that COVID pandemic has had on you as an HR leader and the challenges you're facing in your role. A lot of that centers around a gap in your workforce, as you've described. And I guess some might say we have a labor gap, though I'm not really sure either of us would really like that word. But bottom line, we have a brigade of healthcare workers who've been battling something akin to a blazing fire here for going on 2 years without any reinforcements. And people are tired and burnt out, and some are saying enough. But the fire hasn't gone away, and now you have a backlog of work that hasn't been done in 2 years. And we're facing the prospect of fewer people to do it. So I want to ask you how we're going to manage. What do we need, Kristen?
Yeah, it's the $1 million question, I think, of 2022, and probably will be for the next number of years. I think there's a few things that we need to be mindful of. One is, how do we manage on a short-term basis? And what does that short-term look like? And you referenced burnout and the challenges associated with our staff and giving them a break. And then the second piece really is, what are we going to do long-term? How do we encourage more people to go into healthcare? How do we broaden our offerings in terms of what does that look like from a university perspective? How many seats do we have in schools like nursing? How do we make people, high school students, aware of the types of amazing careers that happen in hospitals that are not necessarily just the nurses, but the lab techs or the pharmacists, and how do we attract those? Those are the longer term things. Obviously, we're not going to reap the benefits of somebody in high school going into nursing or pharmacy or a lab tech role for 4 or 5 years. So we've got to do something now. That's we have to be mindful of. But we also have to be strategic about this. We have to think about what we're going to do long term, to make sure that in 4 or 5 years we're not still wondering or scratching our heads about what we're going to do. So I think short term, there's a few things that I think we can do. The first, quite honestly, is looking at how we staff our areas and our units, and making sure that we're doing it in a way that makes the most sense, and providing the right level of care to our patients, and while also making sure that we're giving our staff the right time. Thinking creatively about different sponsorship programs, whether it be encouraging staff to go into the OR or into areas like the emergency department or critical care, where we do extra education for them, and how do we make that education attractive to nurses that maybe are currently working in acute care. And then we've heard a lot, and it's been in the media a lot over the last little while, about what does it look like in terms of foreign trained professionals, and how do we attract individuals to Canada and to the health system here in Canada, while also always being mindful that when we attract somebody from another country, we're taking away from their health system. And so stealing from Peter to pay Paul. And always being mindful that we as Canadians never want to take people away from one health system and into another health system, because there's a penalty that comes with that in terms of the care that can be provided in other countries. So there's sort of a multiple way of thinking about these challenges, but certainly I think looking at those who are foreign trained, particularly those who are already here in Canada, who maybe not otherwise using that training, and looking at how we engage with those individuals and bring them into the health system and help them get back to the job that they were doing, that they presumably loved in their other country or their home country.
Yeah, we all hear it sounds like a cliche about, right? The foreign trained physician who's driving taxi downtown Toronto. Um, and then one day I took a taxi downtown Toronto before the COVID, and yes, yeah, who was shuttling me around? Yeah, so it's real. Um, but so, I mean, where did these foreign trained professionals come from, Kristen?
So, I mean, they come from all over. We have a number of countries, certainly, that I think I'm more attuned with, but I don't necessarily know that I would protest to know every country that they come from. Certainly, we have a number of individuals that have come from the Philippines as registered practical nurses. But who's to say they don't come from other countries? They absolutely do, and I'll name that one. But there's countless other countries that they come from. And I think you're right. How do we make sure that when they come here, assuming that they're coming here because they want to come here and start their life in Canada, and not because we've attracted them to Sunnybrook or Canada, and sort of, for lack of a better term, air quotes, stole them from another country. How do we make sure that when they get here, they're able to utilize their skills and their knowledge and their background? And yes, of course, there's credentialing requirements within the province of Ontario, and across the whole country, there's credentials that are required within each province. But how do we make sure that they're able to easily seek those qualifications, get the education, and navigate what can be an incredibly overwhelming and complex set of processes, not necessarily by anybody's fault, but rather that they're just processes you have to navigate, and they're in a new country, in potentially a new language, who's to say, and so navigating all of that, and helping them through that. And that's, I think, the role that we along with our government partners, and other organizations can help in order to ensure that those who want to pursue a clinical career like they had in the country that they came from, are able to do so.
So maybe, I mean, you alluded to a couple of them a little bit, but maybe just to go into a bit more detail about, so what is the challenges about, arriving in this country and, and ending up, in meaningful or appropriately, employment.
I was born and raised here in Toronto, so I am by no means the expert in what it's like to move countries. The furthest movement I ever made was to the suburbs of Toronto, so I'm definitely not an expert in this area. But I would assume that there are things like navigating our grocery stores, and where to get your prescriptions filled, or who's paying for those prescriptions, because if you're new to the country, you don't have a benefit plan. So there are things like that. If you have small children, how do you navigate a daycare or school systems, where to live, and everything that comes with all of the basic essentials that I think we take for granted if we were born and raised here in Canada. I don't think twice about where I go to the grocery store. I just go to the grocery store, and I don't think twice about where I get the pasta. I just go to the pasta aisle and I buy them. And so there are components to our culture and our lifestyle that we all take for granted because we do it every day, essentially, without even thinking about it, that I think we never want to take lightly. And I think there are components to that. But then there is the other stuff, so to speak, which is, understanding what the regulations are, understanding what the testing is that you need to go through to get your credentials approved, what education you have to do to upskill or change your credentials to be qualified under the province that you're living in. And all of the components of those regulations. And there are multiple different steps associated with that. And so at Sunnybrook, one of the things we've done, we started internally, and we did a call out to everybody who was internationally trained, but not necessarily providing that level of care at the hospital. So individuals who are, say, a registered nurse or a registered practical nurse from another country, sitting down with each of them and understanding where they are in that journey and what that looks like, and then how to help them navigate. And by help, just making sure that they have the right routes that they need to take, and partnering with organizations, external organizations, to help them through that process, making sure that they know what steps they need to take and where they go. So there are sort of two organizations we've really strongly partnered with. One helps navigate that process, and the other helps navigate things like costs associated with how they're going to pay for it, and making sure that they have, because we obviously don't have the funding to be able to financially cover these costs, and so helping them navigate through what that would look like, answering their questions, and then making sure that, and I've used this term before, and I like this term, which is essentially bubble wrapping them, making sure that they have a place to go to ask questions, they have a place to learn and grow, and they are feeling fostered and supported. And we know that when that all happens, individuals are successful. So working closely with them as individuals, so that they can be successful, because ultimately that benefits everybody. It not just benefits us as an employer, but it benefits them as an employee, and it benefits our patients.
Yeah, I mean, I've had the fortune myself of having worked and lived in two other countries in my life, and I certainly came away with empathy I never had before as a result of that. And I was a proponent that every Canadian should go and live abroad at some point in time, so that we really understand what it's like to be different and other. I even, in one of those, I lived in China for a year, and I got to experience what it's like to be a visible minority. And not many white people in Canada get to say that.
Yeah.
Um, but I do think that our systems and our bureaucrats don't truly appreciate what it's like to move from one country to another, and the challenges that even those that have been sponsored or supported, I think, find themselves in a very difficult situation of trying to, I think, in your words, to navigate, what it's like to sort of start a new life here and to find employment and to create connections and community and all the rest of that. So, um, you talked a little bit about helping people to sort of navigate, I guess, the financial parts of that. Could you go into a bit more detail about what that looks like and how you're doing that?
For sure. So, we've partnered with an organization called Windmill, which is a micro lending organization that helps foreign trained individuals, and they help not just healthcare. They are not specific to healthcare, but we've tapped into them from the healthcare perspective, and they work with individuals and help them navigate everything from the contract that they might be signing with the rental agreement that they are staying in, to working through daycare costs or navigating other expenses. And they have a micro lending. So they, at a low interest rate, provide financial funding to these individuals to ensure that they are supported financially. But they don't just sort of hand them, a check and say, good luck to you. They, work through the mentorship process and partner them with other individuals who've maybe been in Canada for 5 years, but were internationally trained or internationally educated, so that there's a mentorship component to this, which is beneficial not just to the new person to Canada, but to the person who's been here for 5 years, and now they're able to give back. And so it's a way of expanding on that bubble wrap analogy that I used. So we at Sunnybrook can't do all of that. We obviously don't have a micro lending business. We're not in the financial industry. We don't have the ability to navigate, a rental agreement contract or anything like that. But the folks at Windmill have that skill set, and they have that ability, and they are able to add to that. So it's really about giving those who are new to Canada various people or various organizations to support them in their journey, and not sort of leaving them high and dry. I think the pandemic, I think we were already kind of there, but certainly the pandemic has taught us that we are more than just employees. We are, we are members of the community that we live in. We are members of with our families. We have multiple components to our lives that are not just singular in that this is our employer and we walk in the front door. We don't walk in the front door and drop all of our personal baggage, for lack of a better word, at the door and pick it up back up on our way out. So we have to make sure, particularly for those who are new to Canada, they're, you know, the stuff that they've got going on and the stresses that they have are very unique and arguably very, very challenging and new and scary. And so it's very easy to sort of say, oh, I'm going to give up. And to your point, I'm going to drive a taxi and hopefully, hopefully they don't. Hopefully they're able to do the job that they were doing in their home country. And so that's our goal. Our goal is to foster that and support that.
So, I mean, how did you find out about windmill and like, I mean, how did that become part of your solution? I'm really curious.
Yeah, it's a funny story. It was a reach out by the CEO of Windmill to my CEO, and they got to chatting. I think they had a mutual connection. They got to chatting, and then my CEO passed their information over to me, and then I reached out to them, and by strange and weird coincidence, we had a mutual friend, which we had no idea we had, and we got to chatting, and it was a perfect fit. To be honest, it just their goal and their mission and their values aligned beautifully with Sunnybrook's vision and mission and values, and we're all working in the same direction, doing the same work to ensure that the people that are coming into Sunnybrook and who are working here are able to be successful. And they're hitting it at a different angle than we're hitting it, but that's a beautiful partnership because it allows us to do that together. So it's it was a little bit of word of mouth, but they're well known in a variety of industries, and in particular in the financial industry. And so this was sort of, it wasn't a new endeavor for them. Healthcare they'd always been doing, but this was an opportunity for us to really sort of amplify the work that they were doing and really highlight it. So.
Are they local to Toronto, or do they do business across the country?
That's a good question. I actually don't know that they're definitely local in Toronto in that they reside here in Toronto, but I'm not sure if they go broadly. But I would suspect that if they don't, that they have good connections that go to other provinces for sure.
Interesting. Well, maybe some of our listeners will see opportunities to do something similar in other parts of the country. So,
Yeah, for sure.
um, so a couple of things, I guess, that come to mind. I mean, what are the ethical questions about recruiting from other countries? I mean, why are we doing this, or why do we need to do this?
Yeah, I mean it's a good question. I think the big piece, and I've had the pleasure of speaking with individuals from the federal government on this particular topic, and recognizing that we don't want to lure healthcare workers from other countries, particularly countries that may be in a more challenging situation than we are, particularly with COVID, access to things like vaccines, which may be more challenging in other countries than it is here in Canada. And so, you never want to be luring somebody from another country where they might otherwise be incredibly useful there. And you don't want to decimate the health system in another country to the benefit of Canada. It's just not. It's not right. It's not ethical, and frankly, it's just not the Canadian way. We wouldn't do that. So I think our focus really has to be less on luring and less on advertising to come and work here, which to be honest, pre me getting into healthcare, that was done quite regularly. They used to advertise and lure people from other countries like 25 years ago. Now it's really around, if people have identified or are on that list to come into Canada or already are physically here in Canada, and to your point, driving a taxi or doing something that's not in line with what they were doing in their home country, how do we make it a smooth successful transition from where they are at and where they are in their journey to being a fully licensed healthcare worker here in Canada, and what can that look like, and how can we do that successfully? So I think it's really less about luring people away and more about reaching out to those who are here, who are about to be here, or who have identified with our Canadian government that they'd like to come here, and working with them.
Yeah, so it's about helping people who have a background in healthcare who are wanting to come to Canada, and then helping them perhaps more in a different perspective to successfully integrate or land in Canada, and to be successful in their lives.
Exactly.
But we do hear sort of discussions about this being an important, I guess, short-term fix for us, and I know that you didn't create the problem, but why are we here? Like, why are we struggling to find workers, and looking to them from other sources, other countries, undiscovered, potentials within our own country already? Why don't we have you know, um, a stable supply of people who want to work in healthcare?
I actually, it's a great question. I would say that I don't necessarily know that I have a definitive answer. I have some theories for sure. I think, part of the challenge is we need more spots in the education system to attract. I think, I don't think there's a shortage of people that are interested in getting to healthcare. And my understanding is that as a result of the pandemic, there were more people that were actually applying to the university programs, and to a point where some of our universities here in Ontario, the average to get into nursing school is, an over 90 average, which is quite significantly high. And so I think ideally, at the end of the day, it all comes down to, unfortunately, dollars and cents, and how do we expand the opportunities within our education, in terms of academia. Like, how do we make more spots available in the colleges, in the universities? How do we make it more supportive? University is very expensive, and if you are relying on loans to be able to go to university, that's incredibly challenging. So I think, for a variety of different reasons, it does come down to money, I think, and not solely, but I think it's definitely money. Um, and I think, how did we get here? Oh, $1 million question, really. Like, I don't know. I mean, our generations are living longer, which is, I guess, a good thing, right? It's certainly not a bad thing. But that comes with more complexity, and it comes with more illness and more disease, and rising cases of things like cancer are certainly problematic, and so people are sicker. And one of the things I think we've done in healthcare that's really positive is people spend less time in hospitals, because we've learned how to do things faster, safer, better. As with life, we are on a continuum of learning, and so I think we've learned how to do things better, and so we're able to care for patients in a different way. But it still requires nurses and to care for those patients, even if they're only here for a couple of days. And so I think we need to, we needed to be prepared for this. And I think that hindsight's 2020. Nobody could have predicted this pandemic. Nobody could have predicted a pandemic that would last 2 years, or at least certainly I didn't. And I think so. I think on top of a challenging system that was already quite challenged, you've now added a layer of exhaustion, and um, you know, people are leaving healthcare, or retiring early, or choosing to maybe work less, maybe dropping from full time to part time, because they're tired and they're worn out. And so I think it's almost like a perfect storm. So why did we not predict it? I don't know that we could have.
I guess part of what you're describing as well, coming back to the dollars and cents part, is, I mean, that it is, maybe but I mean, I've heard like, is it $100,000 or more than that it takes to sort of develop a physician in our country, because of it's a publicly funded or subsidized health, education system. And so, is it a failure for us to invest in our education systems that, um, you know, that has us, importing labor cheaper, or opening the doors for that from other countries, which are doing it for us instead? I don't know, but I guess part of what you're describing, though, as well. I mean, what is the role for government in this? You talk about bubble wrapping, and
Mhm.
how do we, move people, however they're knocking on our doors, safely into into their role working within Sunnybrook or another institution in the country. What more can government do to support you and your organization and your colleagues across the country?
Yeah, I mean, I would say one of the things that the province of Ontario or Ontario government has done that I think is quite frankly brilliant, and I think should, if it's not already being done across the country, should be looked at, is a program that we refer to as our extern program. So the way it works, both for students, but also for internationally educated, is they can come into the role and we refer to them as an extern. And what that means is they can perform the job, supervised, obviously, but perform the job that they will graduate from doing. So they could be a second year nurse, for example, or they could be on their their plan to become a licensed nurse here in Ontario, and they were internationally educated, and they perform as a nurse, but completely supervised, completely safe, ensuring that they have the right supports in place. But they get the front hands-on experience and exposure and understanding of not only what it's like to do their job, but they get the satisfaction of being able to do that job. So I think that's a program that the provincial government here in Ontario has implemented and funded. And a huge shout out to my colleagues here who've been instrumental in the development of that program. But that's huge, I think, because what that does is, whether we're talking about an internationally educated nurse who's 20 years into their career but new to Canada, or a student who's 21 and in second or third year of nursing school, but it gives them that hands-on experience. And I remember what it was like to go to university and to hear situations and hear how things work, but never really truly understand it. And then you get into the workforce and you're like, oh, I wish I'd known that when I was reading that, article or that book or that textbook or writing that test. And so I think that like hands-on lived experience while going to school, or in the case of students, they could be here for the summer months, and they do it over the summer. Not only does it benefit them because they have a summer job, but they have a summer job in an industry in their background, which is exactly where they want to go, and gives them sort of a leg up to navigate the system when they graduate. So I think it's a brilliant program. My advocacy would be to make sure it never goes away, or at least not for the next 5 years. It's expensive, of course, as is everything, but you've got to invest now to reap the benefits down the road. And I think that it's a great way for whether it's internationally educated or students to get experience and exposure. And also, I would say, get experience and exposure to what it's like to work at Sunnybrook, for example, or another healthcare system in the province. So they get an understanding of what it's like to be an employee at Sunnybrook before they've fully committed. So I think it's a great opportunity for us to showcase to them why we're an employer of choice, but it's also a great opportunity for them to understand where they want to spend their life.
Hmm, interesting. So it's kind of like a co-op, but a funded program at the same time, or?
Yeah, exactly. It's like a co-op, exactly, but there's way more flexibility. So in a co-op program, you have a definitive term,
Mhm.
January to April. Whereas this is so if you're a nurse, say at the University of Toronto, you can be an extern with us and work weekends or work evenings, or work 2 shifts a week, for example, while you're continuing to go to school. So there's an immense amount of flexibility. So it's like it could be like having either a summer job or a part-time job, but in
Mhm.
your area of study, as opposed to working in the local restaurant or whatever.
The gig economy meets co-op, sort of.
That's right. Exactly. Exactly. My CEO would appreciate that statement for sure.
Ah, cool. Very interesting. Um, so anything else that you think I mean, so you've given a good example of what Ontario is doing to support this. Do you see a role for the federal government? Not to get too political here, but if you were to knock on their door and say, you could help us more in terms of getting that bubble wrap or getting people moving through the system, where's the challenge there that they can support?
I'll be honest. I'm not an expert in the federal immigration process. It's not an area that I've studied at great length. But I will say, if they're not already doing this, my wish would be that they identify those who are internationally educated in fields where we are desperate. And again, maybe they're doing this, and I would say more broadly than just healthcare. Like if we are desperate for, I don't know, financial analysts or individuals who have a background in IT, that the federal government is looking at those applications, those immigration applications, with that type of lens, with a very specific and targeted lens to make sure that we are, providing those individuals with opportunities to join our country, assuming that. And again, I'm not a federal expert, and I'm not definitely not an immigration expert. So, assuming that there's appropriate ethical views on everything I've just said, if there was an opportunity to sort of say, okay, here's the 10 applications that have come in today, and these 4 are all healthcare workers. Let's make sure that they, are navigated through the right system. And that they're supported. I'm not suggesting that they have to be expedited, because again, I would be mindful of any kind of ethical components to this process. And I'm not the expert, but I think if there's an opportunity for us to say, hey, we're really looking for pharmacists, or we're really looking for nurses, and if you've got a pool of them, we'd be interested in, who they are. I think that's a huge opportunity for sure. But again, I'm not the expert in that. So perhaps they're already doing that and I'm just not aware of it.
Yeah, it's hard to say. I'm not an expert either, but I would guess that if you did know if it was happening, you probably would know about it. So 'cause they would have to be connecting with you. Um, I mean, whether it's a taxi service or bubble wrap service, right? But it's if they identify people coming into the country, they've already ethically chosen to come here. Then how do they make sure that those people, right, are delivered, or they don't get lost in transit? And there's so many reasons that can happen. I think, as we talked about it at the outset, whether that's in terms of getting settled, whether it's language services, whether it's helping people through the a licensure process, or connecting them with an extern program like you've described. It's You can put all these things in place, but if there's no pipelines that connect people to them, they don't even know where their services or supports might be, I'm assuming.
Yeah, for sure. One of the really cool programs that we do have here that has been slightly put on hold because of COVID, but I'm very hopeful we get back, um, is a partnership with the Toronto District School Board. And so we do have a co-op program here. It's with the Toronto District School Board, where students can apply for or to be a part of the co-op, and they do a 4-month co-op term here at the hospital and work in clinical programs, and get exposure. And typically it's individuals who want to get into some sort of profession within, a clinical field, whether it's medicine or nursing or labs, or research. Very large, a large amount of students that want to get into research, clinical research. And one of the things that struck me in 2019, which was the last, well, I guess the end of 2020 was the last sort of time period where we had this co-op program. But we did an award. We always do awards at the end of the co-ops. And one of the awards that was given out was to a student who was had immigrated from Syria, I believe, and had come here, spoke absolutely no English, and she was in grade 10, and within a year was speaking fluently. And I didn't know that when I met her, and had an opportunity to chat with her and talk to her about her experience as a co-op student at Sunnybrook, and all of the amazing things she got to do. And, her English was spectacular. And she was able to really reap the benefits of the program. But she'd only been in Canada for a year. And one of the reasons why she was successful in that program was because she was surrounded by parents who were able to foster that learning and give her everything that they possibly could to make sure she was successful. And so, that's an amazing experience for her as a student. We were able to give her exposure to a clinical environment. She blossomed like you wouldn't believe, and walked away with an amazing experience. But what was incredible was, her parents were highly educated, but one was, I think, working in a grocery store, and one was, driving a taxi. And so, there's so many areas that I see as opportunities, in speaking with her parents and understanding, their journey, and saying like, okay, well, what are you trained to do, and how can we foster that? And so I think there's lots of untapped components to this very complicated process that I think, over time, we will get better at tapping into and learning. But the programs we've got going right now are amazing, and I'm incredibly proud of the work we've done. And I think, and yet I think there's still lots more to do.
Thanks, Kristen. Yeah, I think a lot of what unites so much of what you've been describing and sharing is around mentorship and supports and navigation, but that to be a new Canadian or would-be new Canadian requires support all along the journey. And I'm certainly very inspired by the kind of work that you and Sunnybrook are doing, Kristen. And I thank you again for being so collaborative and sharing in giving us your insights and experiences. I really do hope they help inspire others across the country to do similar things. I think there's a lot to be learned from what you're doing, and we can continue to learn from each other. So thank you very much again for joining us today and sharing.
Oh, it was my absolute pleasure. Thanks for having me.
Okay. Take care, Kristen.
You too.
Bye-bye.
Bye.
You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.